Hello and welcome. I'm Dr. Yasmine Ali, cardiologist and best-selling author, and this is my podcast, Positive Vibes on the Sunny Side. Each week, my goal is to bring you uplifting stories and insights to inspire you to live your happiest, healthiest, most positive life. So thank you for joining me. Before we get into today's To Your Health episode, I want to give a shout out to the Arab American Women's Society of Georgia, whose lovely members hosted a book club discussion of my novel, The View from the Cliffs, on Saturday. I was delighted to be able to join part of the discussion via Zoom. It was a lively and very fun conversation, and I am grateful to them for selecting my book. I also want to thank all the listeners who've contacted me to share their positive feedback about this podcast. Many of you are saying that these Positive Vibes podcast episodes are helping you, and that is music to my ears, because that is indeed the whole point of this podcast. As I did in the intro to last week's episode, I want to address another commonly asked question from listeners, and that is, how can I support the Positive Vibes podcast? Well, I really appreciate that question, which I've now heard from several of you. And so here are the main ways to show your support. First and foremost, tell others about it. Share this podcast with at least one other person. You can share the link to this episode or the link to the entire podcast from most devices, although it may be easiest to do so from your smartphone. You can just text the link to a friend or loved one who might also enjoy and benefit from the podcast. Just look at your screen for options. For instance, on Apple Podcasts, you'll see a ... in the upper right-hand corner of your screen. Click on that and scroll down the options to where it says Share Show. Click on that and follow the instructions. Most other platforms have similar ways to share, and I'll put a link to the main podcast website in the show notes in case you want to share the link that way too. Number 2, subscribe to or follow the podcast. You'll see the subscribe or follow button on the main screen with the podcast logo, which is the face of the sun with sunglasses on. You've seen it, my Positive Vibes sun logo. Or on YouTube, you'll see the subscribe button directly below the main player box. 3, you can show your patronage and support of this podcast financially by going to the following site, buymeacoffee.com/on the sunny side. That's BUYME, a coffee, COFFEE, all one phrase, buymeacoffee.com/on the sunny side. And the link to that will be in the show notes as well. You can designate how much you want to give, and any amount will help with the production of this podcast, and all support is greatly appreciated. Finally, if you'd like to sponsor an episode or episodes of this podcast, please send an email to info, I-N-F-O, at lastskywriting.com, LASTSKYWRITING.com. That's info at lastskywriting.com with the subject line, Podcast Sponsorship. And now, let's get into today's episode. This is a Positive Vibes to Your Health episode. Now, I know you know this, but I have to say it anyway. This content is for educational and informational purposes only and does not constitute medical advice. nor does it create a doctor-patient relationship. Always consult your own qualified healthcare professional for any personal medical concerns or questions regarding your health or medical condition. Today, I want to talk to you about blood pressure. Now, I've spent most of my life at this point working to prevent, manage, or treat high blood pressure because it's such an important aspect of cardiovascular health. And it's also a very common problem that so many have to deal with. So I want to share just a little bit of my knowledge with you. Why is it so important? Because hypertension, which is the medical term for the condition of high blood pressure, is also known as the silent killer. That's because most people don't have symptoms from it until it's too late and some organ damage has already occurred, or worse, a catastrophic event like a heart attack or stroke. So it's important to get your blood pressure checked, for one thing, at least once a year. And if you go to your annual physical exam with your doctor, that will happen. You see, hypertension causes damage over a number of years to all of the body's blood vessels and the organs and body parts they supply, from top to bottom: the brain, the eyes, the carotid arteries in the neck, the coronary arteries in the heart, the aorta, which is the body's largest artery. It carries blood directly from the heart to the rest of the body, the kidneys, the reproductive organs, the legs and feet. Having high blood pressure is therefore a risk factor for developing all kinds of cardiovascular conditions, from retinal hemorrhages and issues in the eyes, to heart attacks and strokes, to heart failure and kidney failure, to atrial fibrillation, aortic dissection, which is when the lining of that large blood vessel, the aorta, tears and separates from the built-up pressure and years of damage. And this, as you can imagine, is a very painful and can be a truly catastrophic event. And then to even a much higher risk of dementia later in life due to hypertension or high blood pressure. So that's why it's important to me, and always has been throughout my clinical career, and why I hope it's important to you as well, because the other thing about high blood pressure is that it is incredibly common, one of the most common chronic diseases in the entire world, in fact. So if you don't have it yourself, you almost certainly know someone who does. But I'm very glad to be able to tell you that there is good, positive news here. This is positive vibes, after all. High blood pressure is very treatable, and often it is even preventable. So we'll talk about some lifestyle changes in a little bit that can help, things you can even do at home. First, though, I want to be sure we're clear on what high blood pressure, or more accurately, hypertension, actually is. What is the definition? Well, let's start with how blood pressure is measured, the units of measurement. I'm sure you know that blood pressure is expressed in the form of two numbers, a top number and a bottom number, both measured in millimeters of mercury. For instance, a normal blood pressure of 110/70. The top number, 110 in this case, is known as the systolic blood pressure, and the bottom number, the 70, is known as the diastolic blood pressure. Let me explain further what that means. You can think of the heart as a pump, a very muscular pump, whose job it is to receive and pump blood to the rest of the entire body. The heart even has to pump blood to itself, by the way, which is what the coronary arteries are for. And the heart feeds itself first, so it can keep going for you. So the very first branches off that big aorta, which carries oxygenated blood from the heart to the rest of the body, the very first branches are the main coronary arteries. And when someone gets a blockage in one of those coronary arteries, which feed the heart, then that's what causes a heart attack. But back to the pump. So the pump has to squeeze, and the pump has to relax between squeezes so it can fill back up with blood for the next squeeze. That squeeze of the heart muscle, also called a contraction, is known as systole, S-Y-S-T-O-L-E, systole. So the higher number, the top number of blood pressure, is the pressure the heart is encountering when it is squeezing during systole. Hence, the top number is called the systolic blood pressure. Then the heart relaxes, and it does all of this very rapidly. My heart has already done it many hundreds of times since I even started explaining this to you. So imagine that. The heart relaxes so it can fill up with blood in preparation for that next squeeze or contraction. That relaxation phase is known as diastole, D-I-A-S-T-O-L-E, diastole, when the heart muscle relaxes. And so the lower number, the bottom number of the blood pressure reading indicates the pressure in the main arteries of the body. Really, we're most commonly reading the blood pressure from the brachial artery in your arm, right, in the front of your elbow, as you know. But that lower number in the pressure of blood pressure measurement is the pressure that's occurring during diastole, during the relaxation phase of the heart. So it's known as the diastolic blood pressure. So systolic blood pressure is the top number, and diastolic blood pressure is the bottom number. And both numbers matter. So there are guidelines for what both measurements should be to be considered in the normal range. Now, speaking of guidelines, new blood pressure guidelines were released in August, just last month, by the American Heart Association and the American College of Cardiology in collaboration with a number of other related medical societies. These mostly upheld the previous 2017 guidelines from these societies, but have a few recommendation changes worth mentioning. Oh, and by the way, these guidelines are so new that most doctors don't even know about them yet. So by listening to this podcast, you may be learning about them before your doctor has. So I'm including a link to the clinical guidelines in the show notes in case you'd like to share them with your doctor. So first, what is normal blood pressure according to the guidelines, which are built on decades of clinical studies among hundreds of thousands of people worldwide? Okay, according to the guidelines, normal blood pressure is defined as less than 120 systolic and less than 80 diastolic, or less than 120/80. So normal blood pressure is less than 120/80. Above that, these are the categories. Elevated blood pressure is when the blood pressure is between 120 and 129 systolic on top and less than 80 diastolic on the bottom. So a blood pressure of 124/78 would be considered an elevated blood pressure because the 124 falls in that 120 to 129 range. but the diastolic blood pressure, the bottom number of 78, is still less than 80. The next category is stage 1 hypertension. And that's when the top number, the systolic blood pressure, is between 130 and 139, or, and this is important, or the diastolic blood pressure, the bottom number, is between 80 and 89. That or is important because here are blood pressure measurements that would all fit this definition of stage 1 hypertension. 130 over 80, 120 over 80, 138 over 88. Now, most physicians may still consider a blood pressure of 120 over 80 to be normal, but actually having that diastolic number hit 80 is, by this definition, in the category of stage 1 hypertension. And technically, even if the blood pressure was 119 over 80, because having that number of 120 on top actually does put it in the elevated category, even if it was 119 over 80, because of the 80, that tips it into this category of stage 1 hypertension. So both numbers are important. Now, this also brings me to another important point about how hypertension is diagnosed. A single measurement at an office visit is not enough to make the diagnosis. More than one measurement on at least 2 separate occasions is recommended, and the measurement should be taken properly and carefully to ensure accuracy. And you can see my blog post on this. I get very fired up about how to measure blood pressure accurately. I'll put a link to that blog post in the show notes. It's also recommended that out-of-office blood pressure measurements, either at home with a home blood pressure cuff or by wearing a prescribed 24-hour blood pressure monitor known as an ambulatory blood pressure monitor, those should also be used to confirm the diagnosis of hypertension. Then there's the category of stage 2 hypertension, which is defined as 140 or greater systolic or 90 or greater diastolic. So 140 or greater on top or 90 or greater on the bottom. So a blood pressure of 144 over 80 or 140 over 90 or 136 over 90 or 160 over 80. All of those would fall into the category of stage 2 hypertension. So you can see that this gets a little bit complicated, and what you really want to remember, the one takeaway measurement from all of this to remember, if you had to remember just one, would be normal blood pressure is less than 120 over 80, less than 120 on top, less than 80 on the bottom, less than 120 over 80. But why do these categories and stages even matter? Because they guide treatment. For instance, and for the purposes of this podcast, the recommendation for someone without known cardiovascular disease who is found to have stage 1 hypertension, again, that's 130 to 139 on top, over 80 to 89 on bottom. The recommended treatment is to let them try lifestyle changes for 3 to 6 months to see if they can lower their blood pressure that way first before starting medication. But for someone with that same stage 1 hypertension who also has diabetes, chronic kidney disease, or known cardiovascular disease like a prior heart attack, stroke, or coronary stent, then medication is recommended up front along with the lifestyle changes. And lifestyle changes are recommended for everyone, by the way, and that's why we'll get to that. But the reason the medication is recommended up front for those folks is because the risk from the blood pressure compounds when you add other major cardiovascular risk factors like diabetes, like kidney disease, like prior cardiovascular disease. Similarly, someone whose blood pressure is already high enough to reach stage 2 hypertension, that's 140 or higher on top, over 90 or higher on bottom, remember? Someone in that category, the stage 2 hypertension category, is recommended to go ahead and start medication therapy too. Go ahead and start it up front on top of the lifestyle changes. Again, because of the serious risk posed by such a high blood pressure. And this bears keeping in mind. Lifestyle changes can indeed change everything, and you know I am a big proponent of them, but they take time. Whereas oral medication, for instance, can begin working within a matter of hours. And because the risk to one's organs and blood vessels is so great from the higher levels of hypertension, as I already outlined at the beginning, it's not considered a good idea to wait to begin effective treatment. Now, I know well that blood pressure medications, like all medications, can have side effects. But the great news is that there are now so many different medications available for treating blood pressure, many of them available in inexpensive, generic versions. So if a particular medication is giving you intolerable side effects, speak up and tell your doctor and ask if there is a different medication you can try. Sometimes, even just changing the dosage of the same medication makes a difference. But you have to work with your doctor on that, and don't be afraid to do so. It's your life and your health. Now, having said that, I do want to tell you about some lifestyle changes that can absolutely make a difference when it comes to blood pressure, along with bringing benefits to all aspects of your body and mind. These changes can both lower blood pressure and prevent high blood pressure from happening in the first place. And remember that I'm a preventive cardiologist, so you're always going to hear me talk about prevention. Here are just 5 of many lifestyle changes that are supported by multiple guidelines and scientific evidence. Number 1, lose weight if you have excess weight to lose. Doing so depends on many of the lifestyle changes that follow that I'm about to outline in this list. But I'm listing weight loss first because when I was in clinical practice, this was the one that I always saw make the most impact in terms of lifestyle changes. When patients of mine were able to bring their weight down to their ideal weight or even very close to it, they were often able to come off some of their blood pressure medications and to lower the doses on the remaining ones. So, while this isn't the easiest change to make, I'm certainly not saying that, it may be the most impactful, so it's worth paying attention to. And also, you don't have to do it all at once. In fact, if you have a lot of weight to lose, you can't do it all at once in any manner that is truly healthy. But the good news is that studies have shown that losing just 5% of one's body weight lowers cardiovascular risk and may literally move the mercury lower when it comes to blood pressure, too. So, for example, if you weigh 200 pounds and that's overweight for you, then losing just 10 pounds can make a big difference. And most people can lose 10 pounds if they're in this category. So here is some low-hanging fruit, so to speak, to start losing that 5%. Cut out any or all of the following: sugared beverages, and this includes Cokes and sodas, and it also includes diet sodas, which have been shown again and again to lead to obesity through their artificial sugars. Those artificial sugars are not good for you. They are not good for your gut, and they do actually lead to obesity and a higher risk of diabetes. Also in this list of foods to cut out, to look at immediately, beer, desserts, sweet treats like donuts and ice cream every night, and white, highly refined, highly processed bread. If you can squish your bread into a ball, that's highly processed bread, highly refined, and not good for you. It will raise your blood sugar, and it will increase your likelihood of consuming high-calorie, empty-calorie food that leads to excess weight gain. Now, if you eat any or many of those, choose just one to begin with and cut it out of your diet entirely. And stick to that no matter what. Focus on just that one item or category for at least 2 to 3 weeks and see if it makes an impact on your weight. I can tell you that it will likely make a favorable impact on your blood sugar and your triglycerides, which are a form of fat in the blood that is measured along with cholesterol. Studies have shown that it may even have an impact on your mood, your energy level, and your ability to sleep more peacefully and soundly. Then, after you've got that one that you chose under control, move to the next one. Oh, and by the way, I should mention, I've seen men in particular have success in losing as much as 12 pounds in 1 to 2 months just from cutting out all sodas. They just stopped drinking sodas and they reliably lost weight in my practice. And I will say this, it is usually easier for men to lose weight than for women to do so because men naturally have more lean muscle mass, and that helps with weight loss. So, sorry, ladies, it's a little more difficult for us, but it's still very doable, and many women have done this too using the same techniques. The key here is to not give up. Maybe it takes you much longer than 3 weeks to get the sodas out of your diet, for instance. Maybe you go to a party during that time and someone hands you a soda and it's too much to resist. That's okay. You can try again. And I think you owe it to yourself to try again and to keep trying. Many others have done this. In fact, I myself did this many years ago. So I know you can too. Number 2, get regular exercise. Stay in motion as much as you can throughout the day. And in terms of making this a regular event, it can be as simple as a 5 or 10-minute walk after dinner. And I'll link to my article on that as well. Anyone who is able to walk can start with a 5-minute walk. And that makes a difference. It makes a difference to your heart health. Is it where you want to end up in 2 months, still walking only 5 minutes a day? Of course not. You'll want to work up to at least 30 minutes a day, either of walking or a similar exercise, but 5 minutes is a fine place to start, and it does make a difference. Also, if you have a desk job, here is some more low-hanging fruit. Get up and move around every 30 to 60 minutes. That makes a huge difference as well. Just walk around your office for a couple of minutes to start with. I'm telling you, it matters. Number 3, eat healthy, low-sodium, whole foods. The diets most often cited as the most heart-healthy and the most healthy for your blood pressure as well are the Mediterranean and the DASH diets. That's D-A-S-H. Dietary Approaches to Stop Hypertension, D-A-S-H. And I'll link to those too, and you'll see me talk more about the Mediterranean diet because that's the one that I follow and really firmly believe in because it's a delicious diet and a very heart-healthy diet that has been around for literally centuries. And we have discovered more recently in clinical studies all the benefits that it has on blood pressure and heart health and longevity and even reducing inflammation and certain kinds of cancers. So the Mediterranean diet is a wonderful way to eat. But mainly, focusing on eating more whole fruits and vegetables is important, and less red meats. And of course, less prepared foods, because most sodium or salt in the American diet comes not from the home salt shaker, but from dining out or eating prepared or processed packaged foods. And so you also want to avoid those ultra-processed foods like potato chips, donuts, highly refined white bread, and many packaged foods. The ones you see with lots of preservatives and unpronounceable ingredients on the package, a lot of industrial chemicals, you want to avoid those ultra-processed foods entirely. And this will make a difference when it comes to blood pressure as well as many other health benefits. Number 4, avoid alcohol. The new blood pressure guideline is clear on this. No level of alcohol consumption is considered safe when it comes to the risks to one's health, and that includes blood pressure. That old advice about red wine being good for your heart, it's been long debunked over the past many years. So no alcohol. And I will link to a newsletter that I wrote on this a couple of years ago about the debunking of the red wine myth. And again, that will be in the show notes. And then the fifth one, and there are so many we could talk about here, but I'm choosing for the fifth one another one that may surprise you, because it has surprised me as I have read the literature and the studies coming out on this over the past 3, 4, 5 years. So the fifth one is do what you can to limit your exposure to air and noise pollution, both of which have been associated with higher blood pressure and cardiovascular disease. Interestingly, a recent study in the Journal of the American College of Cardiology showed that just having an air purifier with a HEPA filter in the home can lower the blood pressure of that home's residents. So, all right, I could go on forever on this. As I said, it's been part of my life's work, but I'm going to stop there. If you think you'd be interested in a longer online course on blood pressure, though, or you know of others who would you please write to me and let me know? I'm thinking of offering some online courses on topics of interest in the future as a way to round out my Positive Vibes offerings. So if blood pressure is a topic that's of particular interest, I'd like to know so I can include that. I'd also like to know any other topics you would want to have covered. You can contact me through my website, YasmineAliMD.com. That's YasmineAlimD.com. And I'll put that link in the show notes too. Or by subscribing and replying to my Positive Vibes newsletter. And I'll put the link to that in the show notes as well. Many thanks, and I look forward to hearing from you. So here's a fun little tidbit for you. Since you've listened to this episode and you now know the definition of diastole, remember that's the relaxation phase of the heart, you will get the inside joke here. So one of my mentors and teachers when I was a cardiology fellow had a boat. And guess what he named his boat as a cardiologist? His boat was named diastole. Relaxation. Okay, that's how we cardiologists have fun. I certainly hope you have better ways to do so and maybe not be quite as nerdy and dorky as we are. But I had to share that with you and end on that note. I hope that you have a wonderful rest of your week and keep on the sunny side. See you next time.